So yeah, sorry for that. I have started the recording. I hope you are comfortable with it. The purpose of the recording is to also help those who won't be able to join us during the session, at least to have access to the session after this here. So I'll share the recording with you via email so that you may also disseminate it among your colleagues. So welcome, Dr. Rabia. Thank you so much for making time today to have with us to guide us through this session. So maybe I'll give a brief introduction about Dr. Rabia Khan. So Dr. Rabia Khan is the head commissioned research and engagement at the George Institute for Global Health, Australia. Yeah, Dr. Rabia is an experienced public health specialist with over 18 years of experience, and she's passionate about improving health and reducing health inequalities through better use of information and evidence. She has also worked in systems in 3 jurisdictions, that is in New Zealand, Australia, and the United Kingdom, and at the international level. So she has worked across the breadth of health settings in public, private, and not-for-profit sectors. She is a fellow at the Faculty of Public Health, that's in the UK. So that's a brief profile about Dr. Rabia. I want to thank you all too for making it to the session. I know it's early morning, especially those from African countries. Yeah, but thank you for making time. Yeah, so over to you, Dr. Rabia. You can start us off.
Thanks, Daniel. Good morning, everyone, and thank you for making the time to attend this session. And thank you, Students Against Superbugs Africa, for letting me present and host. So I think, Daniel, you already said my first thing, which I was going to say, who am I? But just to give some context, so my background is in research and epidemiology. And I've been now, I think the last time I think I might need to redo my LinkedIn profile. It's now, I think, 20 years since I finished university and I've been working. And mostly, more recently, I've been working on the COVID pandemic here in Sydney, Australia. So I'm just going to share my screen so you can see the slides for. I'm just going to. And sorry. Are everyone seeing the big screen or?
Yeah, it is visible from my end, Dr. Rabia. Maybe
Okay.
a few members can confirm via the chat box.
Yeah, sometimes it's hard to know what's going on with Zoom.
Yeah, I can see some confirmation. So yeah, it's visible.
Okay. Just give me a second because now I can't see my screen. I can't see the presentation.
It's okay.
Yeah. Okay, so I'm just going to show the grid. So everyone can see the screen. Okay, that's good. So the first thing is, I'm glad you all could make it, and we're going to be talking a bit about introduction to data analysis. And one of the things I wanted to kind of let you know that this is going to be a very interactive session. So there will be these quiz polls happening as we go through the slides, and also there'll be some group discussion and individual discussion. So I think if anyone is, just to let everybody know, that's what's happening. So you feel that, when I ask for discussions and please participate and things like that. There are no wrong answers. This is just about learning for everyone. So in the next, I'm hoping it won't take the full 2 hours, but we do have that time. I've left quite a bit of time in the end for question and answers and just things like that. So if you've got other plans towards the end of the 2 hours, feel free to let us know and feel free to leave. So what this 2 hour webinar was, so Daniel told me that a lot of people, most of you are new to the world of research and data analysis. So I thought when I first started, what what would I have liked to have learned back then. So trying to condense this all in the trying to condense all of this into a very short presentation. So I'm, I don't think by the end of it you will become, I don't know, what can I say, experts or statisticians, but it will help you understand a lot of things about analysis. So by the end of this 2 hours, I'm hoping that you can describe the research process, um, understand the purpose of data analysis in research, describe stages in conducting quantitative data analysis, and explain quantitative data analysis. You might have noticed that I've used the word quantitative data analysis, and that's because this for this session, we're going to just talk about quantitative data and not qualitative data. So if that makes sense. So I think our first thing is what is research? And I want to know what you think research is. So Daniel's going to put up a poll, but this is the question, and please answer with the poll. What do you think research is? Is it A, using Google to find the answer to how many types of antibiotics there are? B, gathering information from books on antimicrobial resistance? C, conducting a survey on public attitudes to antibiotics? Or D, writing an essay on the different types of bacteria? So start voting.
I hope the poll is audible, please.
I can see the poll.
Okay, thank you.
Oh,
Maybe Dr. Rabia, you may project
mhm.
the slide with the choices. I hope it's also visible. Members can see it so that they're also able to choose. Yeah, thank you. You can see it. So
Yep. Can they see?
I hope you can see it. Please confirm. Can you see the different choices? Members, please. Okay, thank you.
I can see. Yeah. So it's sorry. Okay.
So maybe can I end the polling, Dr. Rabia? Or should we allocate more time?
I think we've got. I think if we give everybody maybe the next 30 seconds.
It's okay.
So I think we've got about 63% of you have voted. So I'll carry on because some people might be having difficulties in looking at at being able to check their answers. So looks like I think yeah, so it's now 68% have voted. So we will close the polling. So we've got the majority of you think C is the correct answer, and you're right. C is the correct answer, but why is C the correct answer? To C, which was, just to remind you, C was conducting a survey on public attitudes to antibiotics. And we said that is research. And if what, 10 of you got that correct, one of you want to put in the chat box why you think that is the correct answer. Alan, you're right. It is the only one giving us new information. So I'm just going to, so that's the perfect answer. That's the right answer. So the one of the big definitions, I think I'm just going to close this. Yep, Hafswa, you're correct. It is about collecting information from scratch. So it's about collecting new data. It's about data collection is a really important part of research. So the official definition of research is, as you've already mentioned, it's the systematic process of collecting and analyzing information to increase our understanding of an issue, and it creates new knowledge. That's one of the key things about research is it's systematic. We are collecting data, we are analyzing data or information, and we create new knowledge. So that's when you know you've conducted research. So I think this is just to kind of give the context as we talk more about data analysis. So the next thing is, what is the research process? So how do you go about doing research? So, and this is another poll, and please feel free to just think of the first answer that comes to your head in terms of what is the first step in the research process? Is it A, open Excel and analyze the data? B, identify the problem? C, collect data using a survey? Or D, read reports on the problem? So you can just type the answers in the chat box. And it looks like we're getting quite a few Bs. Yeah, so far, so I'm just going to move on. Oh, yeah, I'll wait another couple of seconds. And yes, B is the correct answer. And I think a lot of you have identified that. That is about identifying the problem. And the reason it's good to get that clarity is that in a lot of research processes, but a lot of times people think if their data analysis is research. Yes, Malik, I like your response about solving a problem by carrying out research. And that's exactly it. You want to, you do research to solve problems. You don't do research for the sake of doing research. Would people mind just muting? Well, yeah, thank you. So the 7 steps for the research process. Step 1, as we've said, identify the problem, define the research problem. Step 2, review literature. Step 3, formulate your hypothesis. 4, prepare the research design. 5, collect data. 6, analyze the data. 7, interpret and write the report or make the data available, make the information available. Now, as you've noticed that data analysis is step 6. So we've got 5 steps before we come to data analysis. And all those 5 steps before data analysis are really important because they kind of, it's very difficult to analyze the data if you haven't been involved in the first 5 steps, and you don't understand how the first 5 steps were developed. So it comes right at the end, because a lot of times what happens is people, I know because I've had in situations where someone would come to me, they've collected the data, they'll say to me, can you analyze the data? And I will ask them, what's your research problem? And they go, I don't know. And I feel, and then I have to say, well, I can't analyze your data if you don't tell me what the research question is. It makes it really difficult. Or how did you collect the data? Things like that. So when you're about to do data analysis, it's really important to be able to understand. So you don't have to do all 5 steps before data analysis yourself, but with the people who are doing it, you should be able to, for instance, be able to talk to them and ask them all these questions. I'm not going to go into those 5 steps. That could be, if people want me to, I can do it in a different session. But today's one, we are focusing on analyzing data. And one of the key questions to ask um, anyone when you're about to do this analysis, when they give you data, is what's the purpose? What's your research problem? But before we go into an individual research problem, what again, we're going to go back to Paul and look at what is the purpose of research. And the purpose of research is A, answer questions, B, collect data, C, analyze data, D, win a Nobel Prize. I had a boss that was their purpose for doing research was to win a Nobel Prize. Oh, yep, the answers are coming in. The answers. Yep, I think it's like I feel like I might have given the answers away. No, it's good. Okay, so yes, A is the correct answer. And this was just to kind of make sure that I know it's early, it's quite early in the morning, and so you guys, so you don't fall asleep. So that's why sometimes the questions are just easy to keep people awake. So as I was saying, that when you're doing your data analysis, one of the main things that affects data analysis is what's the purpose of the research. So you kind of have to really figure out the purpose of research first. So firstly, there are 3 main purposes of research: exploratory, descriptive, and explanatory. So your exploratory purpose for research is the what question. So that could be more things like you're interested in a phenomena and you want to understand more about the what. So for instance, you might wanting to know what are the side effects of taking a particular drug or medication. So that's a very what question. So then your analysis is very different for a what question. Descriptive research is when you ask the who, the what, the when, the where. So you might be wanting to know what is what are the different who comes to, for instance, if you did a survey, as we are talking about, looking at students' attitudes to antimicrobial resistance, that's a descriptive research, because you want to know who are these students, what do they do, when do they use these resources, where are they based. So that's more your descriptive descriptive purpose of research. And generally, quantitative data analysis are very good for exploratory and descriptive purposes of research. Explanatory research is more the why question. And that is when you want to know why do people prescribe, why do doctors prescribe antibiotics even if they know it's a viral infection and it's not needed? So that's the why question. And the thing with the why questions are, they're not very, you can't use quantitative data analysis to answer the why questions. You have to use qualitative, so that's interviews, focus groups. So those are those why questions because you're trying to understand people's reasoning. And also, you'll find that, or you use mixed methods. So that is when you combine quantitative data analysis and qualitative data analysis and data collection to understand the why question. So whenever you're thinking of quantitative data analysis, if someone's given you a data set, it's really important to think, is this an exploratory? Are they wanting to know what's going on? Or is it descriptive? So the who, what, when, where question. Majority of the time, it's generally descriptive because people may want to know what is the status of the COVID vaccination rates in this particular region, or did our program work, or who attended, um, or did who attended our antenatal care training program. So those kind of things are very descriptive. Now, so we've covered about what research is, the purpose of research, where data analysis fits in the process of research. So now in terms of just a group discussion, and feel free if you want to write in the chat box or if you want to speak, so just raise your hand and so we can do a mixture of things. And what I want everyone to kind of think about and talk about is what kind of research questions, and we looked at the three, the exploratory, the descriptive, and the explanatory, would be helpful to combat antimicrobial resistance. So think of some research questions, and you can think of them in much more detail in terms of, so for instance, the research question of, which I just mentioned, why do doctors prescribe antibiotics when it's not recommended for a particular disease? So that's a research question. So think of research questions. So either put them in the chat box or feel free to speak and and we'll be doing this for the next 5 to 10 minutes. So it's take some time, think about it. If someone said to you, I'll give you $1 million to do some research that will help us combat antimicrobial resistance in your country, what kind of research question do you think would be helpful? Okay. Hafsa, that's a really good question. What does the general public know about antimicrobial resistance? So that's an explanatory, the what question. Feel free to unmute yourself and talk.
Yeah, please feel free, as Dr. Rabia said, it's a group discussion. So yeah, feel free to unmute. The option is available for everyone. Yeah, so that you're able to
Yeah, I
engage
think
in this act.
I can see Malik has raised his hand.
Yes,
Go ahead.
good morning, everyone. Hello, everyone. Thank you for the opportunity. Thank you, Dr. Rabia, for this opportunity given to us to participate in this tutorial lecture. Yeah, so going by the question you asked us, the kind of questions that will be helpful in combating AML. I think we can ask the general public on the reasons why AML is important. Um, who are the most vulnerable to AML, the age group in a community or a country. Then why are people still not having? I mean, why is there a limited or gap knowledge of AML in a particular setting? Okay, for instance, maybe in Nigeria among students or group of students, why are they not having the adequate knowledge about AML? Um, and again, we might say, okay, why are doctors, maybe some of the health workers in a particular country, why are they not adapting to the antimicrobial guidelines in treating a patient or community? I think basically that's all I have to say. Thank you.
Thanks, Malik. No, that's a good list. And if anyone's thinking of doing research projects, that's quite a good list there that Malik has just said. So I think that's a really good list. And I can see in the chat box, there's quite a few coming in. So it's about Hafsa's, what does the general public know about antimicrobial resistance? Aurelia, what are the health providers' antimicrobial prescription practices? In which cases do prescribers prescribe antibiotics? From Alan, Victor, rate of dose completion and adherence to prescription. Another one from Ellen, what's the level of compliance to antimicrobial therapy by patients? Janice, how can we stop irrational prescription of antimicrobials? Jaconia, how prevalent is the antimicrobial resistance to the general public? Does antimicrobial therapy outcomes improve with culture sensitivity test as a requirement before prescription? And that's from Brian. Anyone want to talk a bit more about their research questions? Feel free to unmute yourself. Daniel, I'm going to pick on you. What questions would you, what kind of
So
research questions
yeah,
would
yeah,
you
yeah. Yeah, thank you for that. So I think I'll begin at home with the students. I think my first question would be, how much do students really know about AMR? In particular, not, I'm sure healthcare students who are the majority who have attended this session, they have quite a big understanding on AMR. But looking out to maybe other students, maybe within other faculties, they know, I think they have little knowledge on AMR. So maybe conducting a CAP survey, a knowledge, attitudes, and practices survey among the students. Yeah, it would create awareness in a way, and it also help inform us maybe what are their knowledge levels, the attitude in relation to antibiotics use. Yeah, so that's one of the key questions. And I think also how we formulate these questions, I think it would be a bit important because we would have to kind of formulate them differently from how we formulate questions that we are asking maybe healthcare students. Another question would be, and I think the results from that survey then would guide us in maybe coming up with other research questions, such as maybe how can we, maybe which are the criteria that we can use to educate these students on AMR? How can we engage them actively? Yeah, such. So I think to make the conversation going, I would love maybe Hafswa, if you're able to unmute, maybe you can maybe inform us more about your question. But before you unmute, I can see Brian has raised his hand. So Brian, feel free to unmute and yeah, share the discussion.
Uh, thank you. My research question is basically about if from my practice, I have seen that culture sensitivity test is not really a practice that is carried out as much before being prescribed an antibiotic, unless a patient is suffering from sepsis, is when it's a requirement to carry out a culture sensitivity test, which is not really an expensive test. So my research question is, will the antimicrobial therapy outcome improve if it was a requirement for you to have a culture sensitivity test carried out before you're given an antibiotic? And I think the research from that will show if a culture sensitivity test is done before you're given antimicrobial, will it be more accurate to the type of infection that you have or the type of bacteria that you're having, and how effective will it be against that particular microbe? Thank you.
Uh, Thank you for that, Brian. Maybe I can maybe add on to your question. I believe the knowledge or the results, the findings that we'll get from this research would be important, because it will also guide the practices among prescribers. But then I also tend to look at it from this angle. After having the findings, then I think we can also build up by maybe doing some research on maybe how much diagnostic equipments do we have in these hospitals, especially in our African setting? Maybe do clinics have laboratories that are able to maybe carry out this sensitivity test? Uh, do we have this health workforce in place to help this happen? Maybe how long does it take before maybe you have the results of these sensitivity tests? Yeah, so that's just to build up the essence being to show us how you can transition from one research to another, and how maybe from the findings of Brian's research, then you're able to determine that yes, indeed, a sensitivity test, they also help in giving more accurate therapy. Then now you come to the question of, do we have these diagnostic procedures in place? Yeah, so thank you, Brian, for that. Maybe Hafswa, you can unmute and maybe share more.
Good morning, everyone. So my question was, what does the general public know about antimicrobial resistance? I think we had mentioned earlier that the reason for research is to answer a question, or in other words, to solve a problem. And I think you can't, a better way of solving a problem is to first know the extent of the problem. So if we know how much knowledge is in the community about antimicrobial resistance, then it can help us conduct our research and also find solutions. We know how much knowledge we need to inform the people. So that's why I chose that question. Thank you.
Yeah, thank you for that, Hafswa. Yeah, and after doing this survey, maybe to build up, I would also love maybe some more members to help us build up on this. After maybe doing the general survey on the public, then maybe based on the results that you'll get, it can also guide you to develop more contextualized service. You know, the way that you would maybe carry out an awareness survey among teenagers, it's kind of different from how you carry it out maybe among professionals, and also the procedures that you would use. Maybe for teenagers, surveys, maybe question answer will be better for them, because it is less engaging. You see multiple choice questions, it is less engaging. They're able to finish up in good time, because also of their concentration span, and also how you formulate the questions based on their cognitive levels and everything. And this you're just able to identify after carrying out your initial research. Maybe this is how maybe uh, these people responded to this and this. Yeah. So maybe Dr. Rabia, you have something to add to the discussion, and anyone else?
No, I think everyone's got really good ideas, and I think it's quite important, as Hafsa said, about describing the extent of the problem. I think that's quite important. And also what Brian said about um, that we do have solutions. So, for instance, the cultural sensitivity test, but no one's using it. So, trying to understand why I'm why people aren't using it. So I think Daniel mentioned it, and so did Brian, is why people aren't using it. Is it the lack of labs, lack of healthcare workers? So these all are quite important research questions and usually they lead to more research questions. And you will find a lot of times as, so for instance, the reason I asked this particular question, because I was involved in developing quite a big research project. And the question was, we had spent, I think, millions of dollars on an AMR campaign and it didn't work. So it didn't, and so we did an evaluation and it didn't work. And so first research question was, did our multi-million-dollar antimicrobial resistance campaign work? So that was the first research question. And then when we found out it didn't work, second question was, why didn't it work? So that's when you can kind of have these. So first it was a descriptive type analysis in terms of who engaged in a campaign. And then the second one was like, did it work? Did it not work? So what was the result of our campaign? Which was, it didn't. But we knew we had all the good descriptives. Then we went into what to explore a bit more. And then we came down to explanatory, where we wanted to know why didn't the program work. So just keep that in mind, that research is never, when you get the answer to your question, you come back to another research question and another research question. But you also have to kind of then think, is how do we implement it? So in that case, when we figured out why it didn't work, we then changed the campaign and completely started from scratch, did it again, and we found this time around, we recently found, because this was a few years ago, the campaign did work. And for the first time in 20 years, our antibiotic prescription had gone down, had decreased for the first time. So it takes but this took a long time to kind of, it's time consuming, but it is quite an important process. So in the interest of time, I'm going to move on to the next bit. And if you any questions, just feel free to put them in the chat box, because I am keeping an eye on the chat box at the same time. Dr. Dismas, you've raised your hand? Go ahead.
So thank you very much, Dr. Khan and colleagues. So my name is Dr. Dismas. I'm privileged to be a prescribing physician, as well as have a deep interest in research. So I interact with antimicrobial resistance at both levels, as a researcher and also as a clinician. And I just wanted to add that what is being said is actually true. Number one, that healthcare providers are either not trained adequately to conduct resistance or sensitivity testing, or physicians are not requesting for these tests, either because of expediency or because they do not see the need. We also do not have adequate microbiology labs that can run these sort of tests. And so even when you request the test, the quality of research that you get in return as a physician then either does not meet quality assured levels that you would wish to have. And also the turnaround times, for most sensitivity tests is in the range of 3 to 4 days on the outside. So sometimes when you have a patient who requires a sensitivity test, then it means they will have a second visit to the hospital. And sometimes it's less convenient for patients to return a second time. In the meantime, you will have started them on an empiric drug based on the patterns that are present in the region where you are practicing. So it is true, there's a myriad of factors that lead to people, I think, empirically treating without necessarily asking for sensitivity patterns. And then this compounds the problem, because then the problem becomes perpetuated by that. So it is true that a lot of work is going on. I know currently that there's a team from the Kenya Medical Research Institute, Center for Microbiology Research, that has been working on antimicrobial resistance for the last 10 years. And also that in the last 2 weeks, there's a team from Washington State University that are setting up a big project both here in Nairobi and also in a western part of Kenya in a place called Asembo. And I think that those will be opportunities for people maybe to jump into a self-build data collection or just learning what is going on. I thought I needed to mention that. Thank you.
Thank you, Dr. Dismas. That was really interesting and very helpful for everybody to also understand some of the factors that could surround why there's been prescribing of antimicrobials and also the issues. So thank you for that. So as I was saying, that there are four main bits of the webinar. So the first bit was describing the research process. So we've gone through that, and it was very quick, I know, and very, very fast. But I think since this one's more about data analysis, we will start skipping towards moving towards the data analysis. So the next bit, we want to understand what the purpose exactly is of data analysis in research. So I think we're going to have another poll, which is what is data analysis? And data analysis is, so start typing your answers in terms of A, using Excel to create graphs, B, using SPSS to do your statistics, C, calculating p-values, D, providing answers to questions. So you can start putting the, start typing in the chat box. Yes, it is a difficult one. The first ones were easy on purpose, Alan, so.
Yeah, let's participate. Just give your answer. There's no wrong answer. Yeah, so
Give another 10 seconds.
okay.
Okay, looks like everyone's answered. So the correct answer is D, which was providing answers to questions. That is the correct answer. And the reason I say that is all of those things is one of the key things about data analysis is it's about turning raw data into useful information, and it's to provide answers to the questions being asked. So you would always have to think of, that's why we're talking about the purpose of research, and research question is, what is the question you're asking, and how would you analyze the data to answer that question? So that is the key thing. That's the purpose of data analysis. That's one of the key things. So for instance, is my program meeting its objectives? So that's a question. So then you have to think is, how would I analyze this data to show whether the program is meeting its objectives? So if I did analysis that looked at how many males and females did this program, does that help me answer the question of, is my program meeting its objectives? So for instance, if your research question was, and I think I'm going to pick on one of the research questions from earlier about what is the level of compliance to antimicrobial therapy by patients? So that's your question. So you need to think of, how would you analyze the data to answer that question? So first of all, how would you collect that data? And then how would you analyze it? Because a lot of times when people collect the data or analyze the data, they don't think about what the actual question is. So this happens all the time. So what sometimes, because as an analyst, people would come to me and say, I just need a p-value. And kind of like, but what's your research question? And they go, I don't have one. I don't have a question. I collected some data of my patients, and usually it tends to be of patients. So they would have done some study, collected the data for some patients, or they just looked at, audited the last 20 patients in their clinic, and they just come to the analyst or the statistician or the epidemiologist and say, analyze my data, but they have no question. So that is why it's really important to kind of think of what is the question that the person, that your analysis is hoping to answer. So sometimes the question could be like Daniel was saying about, is our program effective with teenagers? So then you would want to see the data by the ages, because you want to know whether teenagers are engaging at the same rate as older people. So that's the kind of thing. So you always have to go back to the question. And one of the things is, as I was saying, is in the 7 steps, they're all quite interlinked. So that's one of the things I really can't stress enough is, if you know what your research problem and your research question is, your hypothesis or your research question, it makes collecting and analyzing the data so much easier. So if you're involved in doing all 7 steps, that's good because you're kind of involved. But sometimes you might find, if you are good with data analysis, people will come to you and say, here's my data, do something, find something, kind of thing. And a lot of times I always ask people, what is it you want to know? So it could be all sorts of things. And I think a lot of the questions you guys had talked about when we were doing the group discussion, a lot of them are very good questions because there is, they're quite clear. So you have to think of, there was a question, what does the general public know about antimicrobial resistance from HAFSA? And the reason that's, you have to then start thinking is, how would I collect that data about what the general public know about AMR? But secondly, how would I analyze that data? What is it? Who is the general public? In terms of, do I want to know whether it differs with age groups? Do I want to know if it that knowledge is different in rural and urban areas? So all of those things are really important to kind of clarify in this early stages before you even open Excel or SPSS or anything like that. So that's just really something I always like to remind people, because it's quite easy to immediately go straight into what everybody thinks analysis is that you open Excel, you import your data, you make pretty graphs. That is also part of analysis, but the key part is really understanding what the question it is, because that will determine the method you use as well as the tools you use. So that was a very short bit about the purpose of data analysis, and that's just to remind all of us, sometimes it's quite easy to forget, and even as an analyst, I forget it sometimes, so I have to remind myself as well. So this part, we're going to go through the different stages of conducting quantitative data analysis. I'm sorry it took a while, because some of you might be thinking, oh, this took quite a while to get to what I really want to know. But it's just to kind of understanding the research process and understanding the role of data analysis really helps in then determining how we do our analysis in terms of the different stages. So again, another poll. So what is the first step in data analysis? A, create a graph. B, data cleaning. C, data preparation. D, data coding. Can start entering, open it up for a minute. Okay, I've just noticed there's a timer. So Malik has put in his answer. Thanks, Malik. Thanks, Alan. Thanks, Agaba. Yeah, quite a mix of answers this time. the quizzes are getting more difficult.
Yeah, it's good. Let's continue engaging. I love that most of us are participating. Yeah, and thank you, Dr. Rabia. Seem to have caught us off guard.
Okay, I'll give 10 more seconds. Okay, and we'll move on to, my mouse has died. So C is the correct answer, and that was data preparation. So I like to think of, so different textbooks have different um, ranking in terms of what are the steps, but I would say there are 5 main steps for data analysis. First one is data preparation, data cleaning, data coding, descriptive analysis, and inferential analysis. So we're going to go through each of these steps and for the next, for the rest of this session. So we're now getting into that very detailed bit. And what I mean by data preparation, and we're going to keep coming back to this, is how you receive the data. So that would be, so data prep is about, because sometimes it could be in, so this is more about making sure that the data you receive is in a format you can reuse. So sometimes it can be, if you're very lucky, in Excel, that is if you're very lucky, or Google, or the various with Google Excel or Microsoft Excel, or the version of Excel in a MacBook. So it could be in that format. Sometimes it's a format like CSV, so then you have to translate it. Sometimes it could be as a download from an online survey like SurveyMonkey and stuff. So they might put it in a different format. And sometimes it could be, if you're really unlucky, it could be in a PDF, or sometimes it's handwritten. So some people might have faxed it. So a lot of times you might get data in a fax. You might get it as a scan copy. Sometimes I've also received data which is a photo from a phone, from a smartphone, and they send the data. So it's about preparing the data whichever way you've received it. So a lot of times then you would want to put it in a format that you can analyze it. I would say generally, and depending on the size of the data set, Excel is usually quite good if you're starting off new in analysis. And if you have access to something, if it's a big data set, you've done a few bits of analysis and you think, then I would say SPSS. So depending on those two, I think are the easiest one. So that includes the free version of the Excel that Google has. And so that's what we mean by data preparation, because you want to be able to import the data into something you can use. If it's, say, in a PDF or a scan, then you have to do data entry and then make sure that the data entered is correct, kind of thing. So that's the data preparation. You want to make sure that every one of your fields has got a name that you understand, as well as that it looks complete. So you're kind of just preparing the data. So the second stage is more data cleaning. And that is the stage where you're wanting to find out. So before you can analyze it, you need to kind of go through various steps. So for instance, when I get a new data set, one of the first things I do after I prepare the data, it's nice in Excel or in SPSS, you've nicely laid it out, is making sure that every variable has got a title and a name, and that you understand that name, kind of thing. So that's sometimes what you do in data cleaning. So just to make sure that, and also if it's age or age group, things like that. So you want to be able to make sure they're cleaning. Some of the cleaning I do is looking for missing data. So that's number one, look for missing data, see where, if there are fields, if you've got what percent of each variable are you missing. I also, in terms of cleaning, would recommend kind of doing sense checks. So sense checks would be things like age. So for instance, if your data set has somebody who's 120 years old, and that's happened to me before, you know that's not correct, kind of thing. So you want to be able to, so you're cleaning that out. So you would either go, it's an invalid, if that's just that the age is the only thing wrong. So you're going through all these steps to make sure that you've got all the variables filled in. The variables are within a reasonable range. So sometimes I know if it's height or weight, sometimes in the weight, instead of putting 62 kilos, the person entering the data might put 620 kilos. So again, that's also quite tricky because you either have to consider that as an invalid data or just remove it from from the data set. So in terms of cleaning data sets. The other thing sometimes I find is if people have been given options, say A, B, C, D was the option, and they've put in E, and there is no E in the actual questionnaire. So again, you have to check for that. So you're looking for outliers, either in terms of the possible answers or in terms of possible ranges, so like the weight kind of thing. The next step is data coding. And with data coding, what it means is in both in Excel and in SPSS is to really go through each variable. So you prepare the data set, you've cleaned it, you've got all, there's no more missing, there's no outliers. You don't have people, 120-year-olds weighing 620 kilos. So you've made sure everything makes sense. And in this stage, in this step of data coding, what you want to do is start thinking of like age. So you've got lots of ages. So you're thinking of, am I interested more in age groups? So how do I then create a new variable to say age groups 0 to 18, 19 to 27, 19 to 35. So you're thinking of the age groups instead of ages. You have to think of your question. Are we interested in age groups? So for instance, like Daniel's research question about how teenagers engage. So you might want to create a new variable, which is teenager, yes, no. So you're then starting to create these variables. So if you've got teenager, yes, no, then you need to make sure you code the data and you create another variable. Another time you could do with another variable is, for instance, if you're interested in whether there's a difference between people living in rural areas and people living in remote areas. So you can look at the questions and they might have given the addresses, or they might have ticked rural or urban or remote, and then you can start creating urban versus rural plus remote together. So this is what you're doing when you're doing data coding, is you're trying to create what you need to answer the question. So age is usually one that you might want to convert into age group. Sometimes you might have asked for date of birth, so then you have to convert that to age group. So looking at what was asked, you're coding it to create another thing. Another one we would look at is, for instance, say you want to know how many cigarettes someone has smoked. You've asked the question, how many cigarettes do you smoke every day? And then you've got not a smoker, smoked previously, never smoked 15 cigarettes a day, 25, 2. That is very difficult to analyze. So what you would want to do is then create another variable that looks at someone who is never smoked or quit smoking as one category. And so that's in your one variable. So you might assign that a 1. Then you would assign something like mild smoker between 0 and 15 cigarettes. So that's your, and then over 50 cigarettes a day is your heavy smoker. So you've created this. So this is all the data coding. So this is before you even get to do the analysis. See, there is a lot of work in these things. And I think I've been doing a lot of talking, and everybody might be getting a bit confused or getting tired of listening to me. So I think we're just going to break up again for another group discussion. And this time choosing something quite different on purpose. And it is, so the scenario is the university you are in they have been running this leadership training program, and they have come to you and say, we want to know whether the training program is helping students become better leaders. So they've conducted a survey amongst the students, and they have sent you the data. So luckily they've sent you the data in Excel, and they did an online survey. They sent it to you in Excel. What do you do first? And I think we're going to talk about this for the next 10 minutes. So feel free to unmute yourself, and also feel free to ask questions about those three, like what would you do first? Or you can start typing in, and don't say data preparation. I want a bit more detail than that. So what's the first thing you would do? Someone's just sent you an Excel spreadsheet of data.
All right. Thank you, Ms. Dr. Rabia. So going by the question, what I will do first? Well, um, I will collect the data from the university staff or personnel. Then I will look at it and I will look at the reason why they actually collected the data at the first place. They're looking at how the leadership program can help students become better. So I will look at the age groups. Um, if they are actually looking into, let's say, the students in different classes or different faculties, um, I will take my time to do a rough, let's say, rough analysis or rough preparation by writing the class groups. I might also want to do like something called sampling, looking at perhaps maybe trying to sort out um, do some kind of simple sampling, maybe doing some random sampling or cluster sampling or any other type of sampling, then putting it down. Then before I proceed to um, analyzing the data, maybe coding it, or I think that's what I would do. I might also reach out to maybe someone to assist me, my supervisor or classmates, to look at the data. Okay, then I will then look at if the students have actually understood or gained from the leadership training. I might have to, code those that understood with, let's say, a number, let's say 1, and those that don't understood the program, maybe say 2, and those that are neither understood or not. So I will put them C. So then after that, I might do some statistical analysis, maybe taking the mean or frequency or the mode of those that understood, um, and those that don't understood. So then after that, I will try to get my own results, then send it back to the university. Um, I think that's what I would do actually. Thank you.
Okay. Thanks, Malik. No, that was really good. That's really comprehensive. Hasfa, what do you, I noticed in the chat box, you've said you'll go through the data and clean it to see if everything makes sense. Do you want to unmute and tell us a bit more about what would you look for when you mean everything makes sense?
Well, like you mentioned before, whether like the age groups, like the age makes sense, or just look if the data like is consistent, like for university students, and also if there's something missing or half-filled information. So you want to make sure every data is it makes sense according to the research that is being done.
Sorry, I'm on mute. So that's, no, thank you for that. And Tiffany, you said they received the understandable and analyzable categories based on the responses received. Do you want to talk a bit more about that, Tiffany?
I can try. When we conduct surveys, we probably frame questions to get specific responses from the participants of, for example, this leadership training program. So for me, from the answers received, there's always going to be variation because every single person is separate individual, so they won't give you the exact same answers. So based on the answers received, then you can be able to gauge the responses and figure out how to group them specifically based on the information they have provided, so that the data you get now after you've finished the process is you're able to actually interpret it analytically and get maybe a trend or come to a conclusion based on the response. I don't know if you've understood what I've said.
No, I understand. No, I understand, kind of thing.
Okay.
So it's, yeah. No, so you basically, so what you're describing is more data coding. Yeah.
Yes.
Kind of thing. Yeah, yeah. Yeah, so that's why, yeah, so that's a very important process. And thanks, Tiffany. Ruth, You're talking about there is no missing or erroneous data and then code the data. Where could the errors be? What would you check for, especially in this particular scenario?
I think the missing data could be a question that has not been answered, or erroneous data, maybe a response that does not relate to the leadership training program at all. Yeah, that's what I was thinking about.
Okay, thanks, Ruth. Alan, you're talking about does it make sense, and encode the responses where necessary. Do you want to how would you know if something makes sense?
I think I'd know on the basis of we've spoken about whether the information that people are giving is in relation to the specific aspect we are trying to find out information about. So if they're not giving us information about the particular aspects we are inquiring about, that's what I would classify as this is not making sense.
Okay, thanks, Alan. Anybody else? Any ideas? What would you do first? I think everybody's. Anything else you would want to do?
Yeah, I can see Malik has raised his hand. Maybe Malik, you want to contribute more? Okay. Yeah, anyone else? Let's keep the conversation going. At least, thank you, Dr. Rabia, for the questions. I think they kind of challenge us to check on what we have understood. Yeah. So on my end, I think the first thing will be one to access this data, maybe clean it up first. The data collected, is it just incorporate the students, or are there other maybe people who have been included in this data, and kind of clean it up. Then after that, now I will package it into different substance that I will come up with, depending on the question that I would love to address.
Thanks, Daniel. Anybody else before I move on? Okay. Then okay, I will move on. So I think pretty much everyone's kind of so far everyone who's responded has kind of identified the things in terms of the data preparation. In this case, it was already provided in Excel. I would make sure first thing is that the data you've received is the data from people who did do the leadership training program and were sent that survey, because sometimes it's people might send you the wrong data set. So it's always good to double check that you've got the correct data set, and also that the data set is that the people who, so sometimes they did actually attend the training program. So you would want to have a question, did you attend the training program, or what do you think? So there's anybody who hasn't attended the training program and accidentally got the survey, you can remove them. So you're starting off with that. So that's one of the first things in terms of data preparation, I would like to do, because sometimes it has happened to me when you've been sent the wrong data set and you think that doesn't make sense. And it turns out someone sent you the wrong data set. So that's the first thing with data preparation. With data cleaning, I think a lot of you mentioned already in terms of looking for missing data, looking for data that's out of range. I would also, in terms of this, just have a quick look, because we know with age that it's particular students. So if someone's 14 or 12, either it's an error or somebody got the survey accidentally, or if someone's 100 or 90, again, there could be something that might be a bit wrong. So that time, the way of cleaning, both for looking for errors, looking for missing data. And then in terms of data coding, again, I would put them in categories of, say, with the leadership training program, trying to have an understanding of who the students are. So having questions, coding the data into variables that look into maybe this year's students, last year's students, or if the training program was, if people were asked to give the degree they're studying. So if it's health science, non-health science, engineering. So kind of trying to create these categories to be able to describe the sample. So I think that's one of the big things that we want to know is how do we code the data so we can describe the sample. And sometimes a lot of you would have answered surveys where they have a Likert scale. So, you know, those ones where they say, how do you rate the quality of this training program? And then it's agree, strongly agree, neutral, disagree, strongly disagree. So you might have 5. And that's when data coding comes in handy, because you might split your group into people who agree and strongly agree, and people who disagree and strongly disagree, and then a neutral. So you might convert and code that data from 5 into 3. So you can go 1, 2, 3. So you want to do the analysis that way. One of the things I forgot with the data preparation is depending on, yes, Vincent, yes, we can, I will share the slides for today's presentation. And also, one of the things to notice when you're doing the data preparation, which I forgot to mention, is the way the data has been imported. So sometimes when data is, if you're getting it from somewhere else and you've copied or pasted or downloaded in Excel, it treats some of them as text and some of them as non-text and things like that. So you want to make sure you've coded and made sure that everything is numeric when you're doing quantitative data analysis, and that the variables are correctly in both SPSS and Excel. Because sometimes they don't know. Sometimes when you download the results, it might come in as strongly agree, agree, disagree, or it might come as 1, 2, 3, 4, 5. And in the data coding, it's always good practice when you're doing, if you've done 1, 2, 3, 4, 5, that somewhere in either in SPSS or in Excel, you actually write out what does 1 mean, strongly agree, or 1 is strongly disagree, whichever way you're going. Because in 3 months' time, when you look at those results, you'll be like, oh, was one strongly agree or strongly disagree? Because that's in this stage in the data coding, what you're really trying to do is make sure that every one of your results or your columns are numeric. So they're not text, because you cannot analyze text using quantitative statistics. You can only analyze numbers. So you want to be able, or even with percentages and things like that, you want to be able to convert all of that into numbers and something. And generally, you don't want to have, depending on your sample size, on your data set, you want to keep to 2 to 3 categories for each one of those things. So for instance, with a Likert scale of 5, strongly agree, agree, neutral, disagree, strongly disagree. If you've got a sample of 5,000 people, keep the 5. If you've got a sample of 100 people in your survey, reduce it down to 2 or 3, or you can just say 2 or 3. So that's one of the ways to start thinking of data coding. And this 3 steps would take pretty much a lot of the time. So when you're doing data analysis, I would say you spend about the first 15% of your time figuring out the purpose of the question, the purpose of the data analysis, what's your research question, why you're analyzing the data, how is the data collected. Then that's about 10% of your time. I would say 75% of your time will be in this data cleaning, coding, and preparation. This is the most time-consuming part of data analysis. And the actual fun bit for some of us, for me personally, the statistical analysis is usually just 20% of the time. So this helps with the statistical analysis. I think I've seen some questions there. I think, yes, Dr. James Titai, Daniel will be sharing the recording of this presentation as well as the slides. So moving forward, so we've done those 3 steps, we are kind of going through the 4 stages. we've talked about the research process. We've come up with some great research questions for people who might be interested in doing some research in antimicrobial resistance. We've looked at the purpose of data analysis in research. We've described the 5 stages. So we went into a lot of detail, the first 3 stages. And in this bit, we will go to the 2 stages of quantitative data analysis, which is the descriptive and inferential. So, with descriptive statistical analysis, this is when you're answering that descriptive question, the who, the what, the when, the what, where, the how. So usually it's about describing, summarizing, and organizing the data so it can be easily understood. So you're basically describing your sample. You're describing the people you've done your research on. So if it's a survey, you would say 600 people responded to the survey. We send it to 1,000 people. It's a 60% response rate. That's descriptive statistical analysis. Then you'll talk about 42% were females, 58 were, 42, 50 male and female. Sorry, my maths is a bit slow at the moment. And then the age groups, you can say the median age was 25, but 80% of the people were between the ages of 18 to 30. So this is you basically describing the characteristics. Then you're describing in terms of 58% of people were well aware of antimicrobial resistance, or 42. So it's those kind of things. So that is your descriptive statistical analysis. And a lot of times, a lot of the work you do in analysis, this is key. You have to do your descriptive statistical analysis every single time. So you've done your, once you've got your nice clean data set, you do your descriptive analysis. And then you might do the next stage, which is inferential statistical analysis, but that is a maybe. This is a must. You have to do your descriptive stats. And usually they're presented in tables, graphs, and averages, and I'll show you some examples. But one of the things to think of is, with each of your variable and looking at your questions, is do you need to figure it? Is there something where you're looking at the mean? Is it median? Are you looking at percentages? So do you want to know the percent of people who know what an antibiotic does? Or are you looking at, so the median would be the median age. Generally with age, we would go with median. Or is it, you're looking at the median income? Or the percentage could be, what percent of your survey respondents said yes to never smoked before, that kind of thing. So that's where you're looking at. The mean could be the mean number of, looking at the mean of, if you've asked the question back to the cigarette smoking example, how many cigarettes do you smoke a day? So that's when you have the mean, and you can also have a median just to see. Frequency would be the number of times. So if you're asking in terms of how many, in terms of how many times did you go to the hospital in the last 2 years, or how many times did you get a prescription for antibiotics? So this could be the frequency. Generally, we don't use frequencies as much. We want to convert it into a percentage and or another thing. Rates would be things like mortality rate or or hospitalization rate. So you're looking at, again, you're kind of saying what response rate. So that's, you need a numerator and denominator in that case. And ratio as well. Ratios, again, you wouldn't use that much. So these are just some of those descriptive statistics you need to do. And I would always recommend people to do it first for each and every single variable. And that's when sometimes when you're doing your each and every single variable, you might find some data cleaning or data coding issues. So it's a good way to kind of test whether you've done a clean data set is by running these common statistics on each of your variables in your data set. And then once you've done that, I think, yeah, thank you. Thank you for muting. And so this is quite a key way to do. And then you'll do it for each variable. Then you might want to know, say, for questions like if you had asked the question, have you ever smoked? Yes, no. And you might want to know, well, how does it differ by age? So you might then do a 2 by 2 table. So you basically want to know what percentage of men have never smoked, what percentage of women have never smoked. So things like that. So you kind of then doing your descriptive statistics, but using 2 variables. And then you can, once you start getting into more than 2 or 3 variables in your table, then you need to get into more sophisticated statistical analysis, or else it becomes a very difficult table to make sense of. So in terms of, so this is what normally you would see in survey responses, like in a lot of things, this is a result of a descriptive analysis, descriptive statistic analysis. So in the first one, you've got a bar graph looking at survey results. These are all made up. Survey results in terms of question 1, question 2, yes, no. It is a very bad graph. As you can see, it's because you don't know what question 1 is, and you don't know what the y-axis is supposed to be. Is it percentage of people or number of people? But that's a different thing. It's just to show what you should be doing with your data set in terms of when you first get the data set. This is what descriptive analysis. The second is a table. So that's what it is. And as you can see, as I was talking about, you're looking at the total number of respondents and what the promotional incentives were. So there's things like free samples, ads, coupons. I just took this. I'm not entirely sure what this is directly related to, and both what the percent of by gender. So it's promotional incentives by gender. And this is quite a common way of doing descriptive analysis, descriptive statistical analysis. The next one, this is a much more different way. So not all tables and graphs in descriptive analysis have to be boring. So in this case, they have used a bit more for design and stylistic, but again, same principles. So they're calculating percentage. So they asked the question, clearly they asked the question, do you avoid going to the doctor? Yes, no. 65% said yes, we avoid going to the doctor of the sample. And then the next question might have been, which of the following reasons is the main reason you didn't go to the doctor? So you've got 5 reasons. They did descriptive analysis in terms of the number of people who said they were embarrassed divided by the total sample, and they got 21%. So this is how one of the ways of showcasing some of this data. So it doesn't always have to be boring bar graphs and tables. You can be a bit more stylistic and creative. And I think this is a really good way of especially getting a message across, making it easy to understand for other people, especially if you're trying to convince people to do something. So in this case, for instance, so the biggest reason is embarrassed about the issue, and that's why they're avoiding going to the doctor, which is interesting. This is another example, and this is more what we call an infographic. And as you can see, there's a lot of information here. So it's more to kind of think of how you can present data and the different types of descriptive statistics. So in the first one is about who responded. That's always quite key. So whenever you're doing any analysis, if it's especially with survey, you want to know who responded. And in this case, you also want to know, even if it's not a survey, if it's more of data audit of your patients, you want to know who are the patients. So this is basically describing that they had 850 respondents, and they were, again, this is something I just picked up. So so you can see the different kinds of where people live, as well as whether I think 3% with adults 75 plus, 19%. So that kind of gives you an idea. The next one is about how important generally are recreation and cultural activities in everyday life. So you can see they've done it in 4 categories, the 4-category Likert scale: extremely important, important, somewhat important, not important. And the one about most used parks and facilities. So this is just a way to ask. I think someone's asked us which program can generate such graphics. I think in this, the ones I've used before, sometimes it's just PowerPoint. So you can use PowerPoint. A lot of, there's some other free ones available, like Tableau. So that's Tableau. I can send a few more ones that kind of I think there's one called infographics. So I can send it via email through Daniel to the group in terms of if there is an interest of knowing what kind of software or program can create such graphics. I like the one about at the bottom here on funding support. So this was a yes, no question, but they've converted into likes and no likes. So it's just about how, so this is all descriptive statistics. So descriptive statistics, sometimes people think are boring, but they can be very useful. And in this case, this can be, it will be used, you can see it can be used for decision making in terms of for this particular parks people kind of thing. So I think I've been talking a lot, so I'm going to pause for now. And basically, we're going to come back to the group discussion. And same thing, you all know what to do now. And so we did that same survey on leadership training program. We've got a nice, clean, prepared data set. So what's the next step? We've cleaned the data set. There are no more errors. We've coded it. We've done everything that we need. We can now start statistical analysis. So what's the next step? I'll open it out. Feel free to either talk about it or put it in the chat box. And we might go on for 10 minutes in this because we've got a bit of time. So, and we are coming close to an end. So use this as an opportunity to either ask questions or talk about what to do with your data set's clean and prepared. What do you do next? Thanks, Tiffany. You've said descriptive analysis is a must. What would you do first to do descriptive analysis? And I would say you're using Excel. How would you do the descriptive analysis?
I think for Excel, it's always easier first to describe your data in a table before you can now start making charts and graphs with the data available. So maybe you can start with how many of the students are, so maybe you do gender. So you say how many of them are male, how many are female, and or before that, well, you have to make sure you know how many people actually responded with the correct amount of data so that you're able to now start grouping the data in description that can be understandable. So from there, you can say how many are interested in further implementing the program into actual leadership programs, for example, becoming leaders at the university. So you can always tell from the feedback received, or maybe it was a question in the survey, how many are going to participate in an actual leadership. Maybe it is a club that is being organized, or it is elections that are coming up, and maybe the participants from the training program are actually interested. So are you interested or not? So it can be a yes or no question. And then, yeah, things like that. So you describe the data you've received into descriptions based on the training program that you, yeah, you know, that.
Thanks, Tiffany. Anyone else? What would you do with, how would you do the descriptive analysis?
Maybe Dr. Rabia, allow me to maybe pick up on someone that Janice, maybe you can contribute, Janice, so that we're also able to hear from others who haven't been able to speak. Okay, Janice seems not to be present. Maybe let me pick on another person. Wanjiru Mwangi. Wanjiru, can you hear us? Okay.
Feel free to type in the chat box if you're
Yeah, I can see Malik. Malik, your hand is up. Maybe Malik, you can
Malik.
unmute.
Yeah, actually, thank you, Daniel. Thank you, Dr. Davia. Actually, going by this, I think we just start with dispute analysis, okay, making a table, okay, by classifying the data, the number of responses into respondents into the median frequency, or trying to take the percentage or ratio, and then making a table or graph, and where you can use either the Excel or the SPPS.
Thanks, Malik. Haspa, you said you described the data in terms of percentage of students who've become better leaders since the training. How would you know? I'm just curious, how would you know if someone's become a better leader? How would you measure that?
Now he's asking, I'm realizing it's a hard question to answer. But then maybe we could use some variables, maybe how many people have been involved in leadership activities since the training. So maybe in terms of implementation of what they learned in the training, though it's hard to measure whether someone has become better, but maybe we could use some variables that can help us gauge.
A very good answer, Hasfa. That's it's good to see what the variables are. I think, Derek, you said you checked the different variables in the data set and use the problem statement and come up with common characteristics of the variable. Would you mind explaining that a bit more, Derek? What you mean by problem statement?
Okay, I will first check the different variables in the data set, like what is my target? Is it the youth? Then check is it youth and adults, and then come up with the common characteristics of those different variables, just to know what comes into the columns, and being able to build the table from those descriptions.
Okay. No, that's no, that makes sense. No, that's good. Anyone else?
I'd like to answer that.
Yep.
You can hear me?
Go ahead. Yes.
Yes.
Go ahead.
I was just saying, among the variables, if there was any variable that measured if someone has taken up a leadership opportunity for a duration of time, maybe for the last 6 months or maybe for the last 1 year, and the timing would be prior to the survey or when the survey was done to the time that you received.
No, that's a very good point. Sometimes it's quite
when the survey was done.
I think we've lost you, Winnie. We lost you in the right at the end. Okay, Winnie's going to type it up for us. I think she's having audio issues. Anyone else while we wait for Winnie to type it up?
I can try chipping Dr. Rabia. Yeah, I think one of the things that you can have in place, maybe it's have variables or assess behaviors that portray leadership among these students. Maybe check whether any of them has maybe started an initiative, or have they been addressing particular situations. Yeah, and I think maybe from that, then you're able to kind of analyze the changes, maybe how they were behaving prior to how they are now behaving after partaking the leadership program. Yeah.
Thanks, Danny. No, that's a really good point, because we just know that this did the survey after, but a better design would have been to do a survey before the training and a survey after the training, and then you could then compare before and after if there's any difference. I would say, in terms of this, one of the key things is describing who the people are in your data set. That's the first thing. The respondents, who are they? Like we saw in some of the other graphs. And then secondly, looking at if we've asked knowledge, if you've asked questions about their feedback on the program, and then as Hafsa was talking about, then in terms of what questions can we ask to see if they've become better leaders. So you can then start dividing your analysis into that. So I think, because in the interest of time, I'll move on to the next bit, and so that we have a bit more time at the end. Okay, Winnie's just responded. She said how to measure if there's any leadership impact, if there was a variable that was assessing whether a student had taken up a leadership opportunity from the time the leadership training was done and during the survey. So that's an excellent point, Winnie, and I think it's quite important, as you can see with this survey, that you need to think of these questions before you do the survey. So you have to make sure that you ask a question that is about, so did you take up a leadership opportunity? Yes, no. What kind of leadership opportunity? Did the training program help you? And things like that. So, no, the great point, Minnie, because I think it ties back to why you can't do your analysis properly unless the data collection and your research question and research problem have all been done in advance. So we talked so far about descriptive statistical analysis, and then I'm just going to cover inferential statistical analysis. So you always do your descriptive first, and then you do your inferential. So I'm just going to touch on this because this is what most statistical degrees are about. So if you are interested, I would say look at more statistician type resources. And generally, it's about generalizing from samples to populations. And what do I mean by that? And with that, I would mean is, for instance, if you wanted to know what percentage of doctors in, like for instance, in Australia prescribe antibiotics, you would then make sure that the survey you do is reflective of the population. So that's when you use your inferential statistical analysis, is when you're trying to generalize. You have to make sure your sample's big enough that you can then say that we are pretty sure 50% of doctors prescribe antibiotics without inappropriately. So that's when you use inferential statistical analysis. You can't generalize from sample to population with the descriptive stats. You can only do it with inferential. The other thing would be hypothesis testing. And with the hypothesis testing, this means that you want to know, so far, if you wanted to know, for instance, how Daniel said, whether the leadership training program before and after, if they've changed in terms of their due to the training program, then you have to do a before and after survey. So again, that's inferential statistical analysis, because you're trying to do, did the program change? Yes, no. So you're doing it. So then you use a different kind of statistical methods. The third one is the ability to make predictions. So that would be, again, you're using something, a statistical analysis tools. I'm not going to go into the details of the tools you would use for this, but you're trying to make predictions. For instance, COVID is a good example. So you've got COVID infection rates over the last 12 months that the pandemic's been on, and you can see the number of cases over time. And then you can use inferential statistics to then predict whether that number is going to go up or down or stay stable. So your descriptive analysis can just describe how many cases. So the things like how many cases we have of COVID, how many people have died from COVID, they are descriptive analysis, that's descriptive stats. If you want to make the prediction, is it going to go up? Is it going to go down? That's inferential inferential statistical analysis. And the other thing with this is it's about you're trying to draw a conclusion about the population based on the data in your sample. So that's one of the key things. So you're trying to do that. Whereas in your descriptive statistics, you're describing the people in that you have done the study on, the survey or the study or whichever things. So if you are interested to know a bit more about these inferential statistics tools, so these are just some things if you want to look them up on a textbook or Google, because I think each one of them are like a course in themselves. It will be things like regression analysis, hypothesis testing, confidence intervals. So when you hear about p-values, a lot of this, and this is where that's inferential statistics and time series analysis. So these are some of those terms you might want to look up. Now, I know because I'm just looking at the time, and I know people have got classes to go to and other things. So just to wrap up, I hope by this end of the seminar, you are quite comfortable and about to know what the steps for the research process, where does data analysis fit in? What are the different stages in conducting quantitative data analysis? And then be able to understand and explain about descriptive statistics as well as inferential statistics. I can see a couple of things in the chat box, but before I respond to it, just to recap, if it would be nice if everybody can say the one thing that they've learned from today's webinar that they didn't know before, and one thing they want to learn more about. So either you can unmute yourself and let us know, or and have a think about it while I answer the questions in the chat box, or you can put it in the chat box. So I think Vincent asked, if the objective is to know how students have become better leaders, then it's only fair and reasonable that during the survey, variables on how better one has become leaders are taken into consideration. Yes, that's quite true. So that's what we're saying is your questions will determine how you're going to analyze the data. And for George asks, thanks. For me, it is how to measure in case of leadership impact. It is reasonable that a survey variable could be taken up to become a leader is highly appreciated. That's right, George, because I think it comes back to how you ask those questions. And for instance, if the university, when they developed the survey, was thinking, do people like the leadership training program? It's a very different types of questions and analysis than saying, did the leadership program make better leaders? So that's why it's so important to know what is the question you're trying to answer before you start collecting the data. Because a lot of times, it's only after you've collected the data you think, we should have asked whether they became better leaders or what the impact was. So that's answering the question. So, okay, we're getting some answers. And if people want to unmute themselves, feel free, but I'm just going to read from.
Yeah, okay. Yeah.
Go ahead, Malik.
Actually, good. Thank you, Dr. Rabia. Really, it was a nice presentation. Thank you so much. I really learned a lot today. One of the things I learned was basically what research is and how the different types of data analysis and what data analysis is all about. Okay, it actually exposed my mind to different kind of analysis. I really appreciate that. I hope I will be able to teach my other colleagues in school. Yeah, thank you so much. Yeah, there's one thing I would like to learn more about. You mentioned about literature review in one of the steps of the research. Okay, I was thinking maybe when we are drawing a conclusion, how could we compare and contrast our own results? Perhaps maybe we have conducted a research on number of students that have knowledge of AMR. Okay, so how will we compare our results to those the literatures we reviewed? Okay, maybe from the data they collected, get it from one studies in and elsewhere to our own local studies. Then how will we make our inferences before we reach a conclusion? And again, I don't know if you could explain how we could do calculate our sample size. You mentioned that in inferential statistics. So how can we actually calculate sample size from the population? Yeah, I think that's all. Thank you.
Thanks, Malik. Just reading some of the questions, and I'll just go through the questions. So Hafsa said the new info is steps of data analysis, and Tiffany's how important descriptive analysis is in the analysis of data and the differences between descriptive and inferential analysis. Ruth, is inferential statistic analysis also a must in a research? Is that a question, Ruth?
Yes, it's a question.
Okay. It's not always a must. It depends on your research question in terms of inferential statistical analysis. Because sometimes you might be just wanting to know if people, what people's, who is attending your training program, or who's attending, say, if you're running a service like a maternity healthcare service or something, or antenatal service, and you just want to know who attends it and why they're attending, then you wouldn't need to do inferential statistical analysis. So you don't always have to use that. It depends on your research question.
Okay, thank you.
Yes. Hafsa also likes to know more about data presentation using the different tools mentioned, like Tableau. Okay, I think with a lot of these ideas, thanks, Hafsa. I think if we have a list of topics, maybe we could organize a second session, because I think the list is getting longer. And I can send some resources on these questions on both the literature, about how to infer from literature review, as well as calculating sample size. So I'll send some resources that people can use, as well as data presentation. I think Alan's just put in that learning the logical steps in quantitative data analysis, demystify the process, showing something to be scared about or bored with. Thank you very much, Alan, about it. It's not to be bored and scared. I think with good data analysis is about having a good research question. Kind of thing. You can't have one without the other. Anyone else? What are the things that you've learned today, and what things you want to learn more about? Because I think one of the big things is there's a lot you can learn about this. And like for Monica, you said about literature review, that's a whole big session kind of thing on its own. Because, and I would always say to people to do your literature review before you collect your data. So sometimes in terms of if you collect your data beforehand, if you do your literature review before you construct your data survey or collect your data, you can make sure that you ask the questions that you can then compare. Kind of thing. So that's really important, because a lot of times people do the literature review after. That's why step 2 is review the literature and see what other people have done, because a lot of times you would get to a stage where you understand the problem, but you read the literature, and then you'd be like, oh, does this apply in my setting, in my university, in my area, in my country? And you might find in the literature someone's already answered that question, and if they're not. So I think it's quite good to do that beforehand. Just reading through more, I think data presentation seems to be quite popular. The other thing, using a tool like Tableau, inferential analysis. Yes, I think it is inferential analysis is quite important, and it's also quite a big topic. So I think it will be something that and a lot of it's taught in basic statistics courses or basic epidemiology courses, if you are interested. Designing good research questions from Aurelia. That's really important, because I think one of the biggest things in research is about designing a good research question. Half of your problems are solved if you design a good research question. I think about data, how to handle data after data collection from Ruth, and the use of some of the mentioned tools for data analysis. Ruth, are you talking about descriptive tools or inferential statistical tools for data analysis?
I've been wondering about the SPSS program. I don't really know what that's about, but I know of Excel. So including also the tools in inferential statistic analysis.
Okay, thanks, Ruth. I would say if you're starting out new in data analysis, and this is for everybody, I would play around in Excel first. SPSS is good when you've got very big data sets, and also when, so if it's less than big data sets, I mean more than 5,000. If it's less than, if it's 500, 1,000, 1,500, Excel is easier to use. And if you're doing descriptive statistics, it is fairly good kind of thing. I would use SPSS if it's a bigger data set and you're doing quite inferential statistical analysis like time series, or even some of the tools. You can do regression in Excel, and you can do a lot of those things in Excel. I think Hafsa, go ahead, and then Malik. So Hafsa first.
I have a question. So when you're describing the data coding, like it sounded so simple, like you group it either into age groups or whatever. But then I think it's a bit harder. How do I know? How do I group this data so that it makes sense? Like, is there like a formula you use, or the more you do it, the more you get familiar with it? Like, if I just have a set of raw data, how do I determine which way I'm going to group it so that it can make sense?
Good question, Hafsa. There is no formula. It comes with experience, and also comes back to your research question. So, for instance, with age, depending on the question and depending on various things, I would tend to kind of, so if I'm interested in university students, and generally most university students are between 17 to 25, I would put that as one category, and then above 25 in another category. So that's where I will draw the line. If I'm interested in just like a public survey, I might do different age, like 0 to 18, 18 to 30. So that there are some general age categories we would use, but a lot of it does come back to what the question is and how experienced you are in terms of doing that categorizing and coding. Malik, you had a question?
Yeah, I think I've actually asked my question. I asked you.
Okay.
Yeah, so I was expecting your response or your replies.
Mm.
I actually asked how to calculate sample size from the population, and how to compare our local results with the literature reviewed.
Okay.
Thank you.
I think I've seen some, James, some people do clean and code from analysis software. Would doing it in Excel before importing into the software be acceptable? Yes, James. So I think depending on, so for instance, if I've got a very large data set, then I would generally do the cleaning and coding either in SPSS, SAS, or R. So it depends on or Stata. So there are quite a lot of software. And if you've got a very big data set and you're quite experienced, I would say to clean and code in the software itself. If you're new to analysis and you've got a smallish data set, then I would use Excel just because, and you can do either or in terms of it's acceptable. It's just when you, like, for instance, one of my data sets had about 15 million rows. So then I use SAS kind of thing, because doing coding 50 million rows would take up too much energy kind of thing. So Vincent, do you want to answer Hassa's question?
Hello, hi. Can you hear me?
Yes, we can hear you.
Yes, actually, you actually answered. I wanted to say exactly what you said, because when you're dealing with data, there is no particular path or way to follow. If you're working in a field, sometimes you look at the interventions that you're going to make, your data conclusions that you're going to deduce from what you have collected. How is it going to positively impact, a problem that you're dealing with? I can give a good example. If you're dealing with antimicrobial resistance or something of that sort, you have to look at the challenges that you're facing in the field. And what change or suggestion are you going to bring into the field bring a positive impact, you're going to look at who are these target groups that are badly hit or suffering the most from antimicrobial resistance and stuff like that. So you're going to find that age is going to be a factor, because you find that the more aged people have these infections, and then you find the immunity goes down, so their capability of fighting infections or antibiotics being effective in them is an issue. Then you can come into gender, and then to gender you want to look at how is it that either men or women are adversely affected of the same. Is it the hormonal changes or imbalance, or is it something else? So the data, I think the more you do these studies, the more you get yourself involved in research, you become to have an idea of, I'm going to slot in this, this variable here. You realize that in data analysis, if you're going to work on something and the variable you're working on does not actually bring out a positive or a significant effect in your data, then you realize you're not utilizing your resources well, because it's something that you could have left out and still your research findings, come out. So I think it's something that you get used to. The more you do it, the more you start understanding your field. So that's why you get to, people specialize in an area, because they know the moment they look at a research question, or they developing a research question for that matter, they know that once I carry out my study, I know I should be getting data or findings that are going to boost and try to make this field or area a better place, or improve on the same, because at the end of the day, that is the whole essence of research. Yeah.
Thanks, Vincent. That's a very eloquent answer. Thank you for that. I think you said it much better than I could. Thank you. I think, as you said, it is. That's why I always say, if you're doing research or analysis, always involve the people in the field in your research and your data analysis. So, for instance, if there are clinicians in the field and you're academic or a researcher, you want to make sure that you're working with them, because sometimes they, as Vincent said, they know the data better, they know what the questions are, they know what the issues are, kind of thing. So thanks for that very important information. I think there's a question from Hasfa. I think we've done 2 hours now, and I'm very well aware people have things to do and places to go, and some of you have university to get to. So I think, Daniel, should we end now? And if there are any other questions, people can send them later, or if they've got, and you'll be making the presentation, the recording available and the slides.
Yeah. Thank you so much, Dr. Rabia. Wow, it has been quite a very intensive session, and I kind of guess most of the members in the house will want to have you once more, so that you can also take us through. Thank you so much for preparing that, taking us through, being patient, answering to our questions, engaging us through different questions. Wow, on my end, I've really learned a lot, and I believe we have all learned something. Yeah, and also thank you to the members, especially those who have managed to stay put till now. I know it's kind of still morning here in Africa. Dr. Rabia, on her end, it's kind of getting to dusk. I think it's around maybe 5 p.m. Yeah. So
7 p.m. here.
And yeah. So yeah, I really love thank all of you. So as per organization culture at SCS Africa, we tend to cascade what we learn with other people. So we have done a tweet. So how we end our sessions is, in every session, we do a tweet. Then after the tweet, each member I hope you all have a Twitter account. Let me start with that. Yeah, after each tweet, each member, if you have attended the session, you reply with what you have learned. You can like or retweet, but the main thing is you reply to the tweet with the main take-home points that you have gathered from this session, so that in a way we are also able to educate other members out there, and we'll also share the recording publicly. But not all of us have that time maybe to go through a 2-hour session also. Yeah, so kindly check the chat box. Yeah, I think I have incorporated I've shared the link to the tweet there. Please retweet with reply with what you have learned during the session. The key take-home point. Yeah. So once again, in case we have any other questions, I will channel them to Dr. Rabia, and then once she replies, I hope we have all your emails. They have been, at least we have them in the Zoom database for this session. So we'll share the recording. I will also share the presentation and maybe replies to any other questions that you may have. So as we end the session, I have seen quite some interest in other areas. So maybe just before we end, I would love if you have any other session that you'd love us to talk about on research, and you have not indicated it here, kindly please indicate it in the chat box so that we're also able to organize another session. I have seen quite a couple. We'll see how we can have another session on those, but maybe viewers has been left behind. Yeah, so yeah, don't worry, the recording shall be shared. I can see some concerns. Yeah, we'll share the recording via email to all your emails. Yeah, so with that, Dr. Rabia, thanks once more, and I hope from these we'll be able to engage in the research. The reason why we organize these sessions is because we realize, we know the potential that students have, especially in doing research and other active initiatives in regards to mitigating the threat of AMR. So maybe if you have learned something today, you can go take an initiative, kind of do a survey or something that can help us in knowing the current situation about AMR. You know, we have very scarce data on the same as of now. Yeah, so with that, I will hand over to you, Dr. Rabia, to close the session for us. And for me, I just say thank you, everyone. Thank you, Dr. Rabia. And I hope we'll get to see each other once. Thank you. Gracious.
Thanks, Daniel. Thanks, everybody. Thanks for taking 2 hours. And I hope I haven't bored people, because I know I like research and analysis, but not everybody does, kind of thing. So hopefully you found it useful and you didn't get too bored. Yes, as Daniel said, it would be great. I think I really like the idea about sharing on what you've learned on Twitter so other people can learn it. And I think that's a great idea. And also, I think sharing this with other people you know would be great, because I think it's quite important to be able to demystify what data analysis and research is, because people think you have to be super smart or have all the fancy software to be able to do data analysis, and sometimes it's not that difficult. And I hope this has given you a taste, so some of you might want to do research in the future or might want to become more interested in data analysis and things like that. So thank you for taking the time. I know 2 hours is a long time, and hopefully and have a good rest of the day, because it's still your nearly lunch. No, not yet lunchtime, but for me it's definitely dinner time, because it's just 7 p.m. here.
With that, goodbye, everyone. Yeah, please remember to reply with what you have learned. Yeah, so that we're able to, because that's the main, you have learned, but you learned something and keep it for yourself, then I think it won't benefit others. Yeah, so let's try sharing what you have learned with other people. So with that, have a wonderful, I think we are almost approaching afternoon on 9, and Dr. Rabia, have a wonderful evening. So goodbye, everyone.